my name's Megan, and I'm going to do the dressing change pass off. So I'm going to check the patient's chart, and it looks like she is due for a dressing change at this time. So I'm going to go and do that. I'm going to gather all of my supplies. I'm going to perform some hand hygiene before entering her room. Okay. Hi, Miss Smith. How are you doing today? Oh, good. I'm glad to hear that. So I was in about half hour ago and gave you some pain medication because you said your wound was just hurting you too much, right? Does it feel like that's kicked in? Okay, good. So are you okay if I assess your wound now? Okay, I'm gonna close your curtains real quick, okay? And then can you just confirm your name and date of birth? Perfect, that's exactly who I need. Okay, so what we're gonna do today is I'm gonna take a look at your wound, we're gonna clean it, make sure that there's no infection in there, and just take a look at how it's doing, okay? Okay, good. So I'm gonna raise your bed up a little bit so that I don't have to break my back. Okay, and are you in a comfortable position? Is this okay? Okay, good. Okay. So I'm gonna wash my hands and I'm gonna get some gloves on real quick, okay? Let's grab some gloves. Okay. So when we look at this, I'm gonna try and keep you covered as much as possible, okay? So what we're gonna do is just work your bath blanket down a little bit and pull up your gown. Okay, good. Is that okay? Not too cold? Okay, good. All right, so then what I'm gonna do is I'm going to take off her bandage that's on it right now. So I'm going to do that using a push-pull method so as to not create any other issues from having adhesive on her tummy. Good. Is that feeling okay? Okay, good. Okay, looking at it, it's looking like you have a moderate amount of serosanguinous fluid on here, okay? There's no pus present. Serosanguinous means that it's just like a healing color. Yeah, so it's kind of a light pinkish, but not red, not yellow. Yeah, it's looking really good, okay? There's a moderate amount. No odor that I can tell. It's looking really good. So I'm gonna fold this up and I'm just gonna put it in the trash. But before I left her room, I'd make sure that I put everything that's in my trash in my red biohazard bag. Okay, so that is looking really, really good today, okay? So what I'm gonna do is I'm gonna take this and I'm just gonna hold it above the wound and I'm gonna measure your wound real quick, okay? We're just gonna see how we're looking. So we're looking like about 10.5 centimeters by about 2 centimeters. And then for our depth, we're about 1 centimeter, okay? So that's looking really good. Yeah, it's doing awesome. All right, so now what I'm gonna do, I'm gonna take off my gloves, I'm gonna get some hand sanitizer, and I'm gonna open up my sterile field. Let's get this away from the bed a little bit. And I always want to make sure that I open it away from me. I just want to make sure that I have 1 inch border around the whole thing. Except I should have sterile gloves on before I'm putting all this out. So I'm going to hurry and get some sterile gloves on. And then I would reopen all this stuff and place it back on there. Making sure I only grab the outside cuff, maybe. And this one, I'm gonna try to only grab the inside, or I guess the outside of the cuff like that. Okay, so like I said, I wouldn't have gotten this stuff out, but for purposes, I'm just gonna say that I am now starting to grab everything out, put it on my thing. This. Okay, and now I'm going to open up my solution. My gauze into the solution. Just get them wet. Okay. And then I'm going to do is I'm going to only clean with my right hand so my left hand stays sterile. So I'm going to go top to bottom, and then with each one I'm going to get a new gauze. Top to bottom and inside to outside. And then I'm going to go top to bottom along the outside. And then top to bottom along the outside as well. How is that for pain? Is it okay? Okay, good. Since my left hand is still sterile, I can grab these gauze off of here and be able to do the same technique with drying. So I'm going to go top to bottom, inside to outside. Top to bottom, inside to outside. Outside, top to bottom, and then along the outside, top to bottom, like that. Okay, and now I am going to change out my gloves. And I'm going to wash my hands. Okay, and I'm going to grab another set of gloves. And that ripped, so that's actually not sterile anymore. So we can have a fresh pair. Okay, and so then this is the point where if she had anything ordered, I would put any kind of creams, antibacterial ointment, anything on the inside of that just to keep it clean. And but she doesn't have any orders for that. So what I'm going to do now is I'm going to get her ABD pad, which is this right here. And if she had a lot of excessive drainage, I would put extra pads in here just to help to keep it dry. But she didn't have a lot of excessive drainage, so we're just gonna put just the one pad on, like this. You wanna make sure that there's a 1-inch border along the whole outside. And then I would grab my tape and I would want to tape it in what is called a window pattern. And I would put some ointment along it to help with the adhesive so that it doesn't hurt her skin. So I would do that. And like that. And then I would do one more across the bottom. Like that. And then grab my red bag and throw everything in it. Scissors would go in the sharps container. And then I would dispose of this how it needs to be disposed of according to company policies. And then everything that's in my trash would go in here as well. And then I would put it in the biohazard bin. And then I would take off my gloves. Perform hand hygiene. Okay, how was that today? Was that okay? Oh, good. I'm glad it wasn't too painful. Let's get you covered back up and get you comfortable, okay? How is your pain right now? Okay, that's not too bad. Let's lower your bed so you can be safe. Okay, now I'm gonna put your bed rail up, okay? And I'm gonna make sure the other side is put up as well. Here's your call light if you need anything. Put your head up a little bit. And then your water is next to you. At this time, I would notice any drains, if there was any of those. I would have cleaned them and made sure that they were taken care of when I was assessing her wound. But she didn't have any drains or anything like that, so I didn't have to worry about that. If there was any abnormalities, I'd make sure to document that and talk to the doctor about it. And then I would just make sure that if she had any questions, that I answered those. And everything looked well though, so she's good to go.